A group of experts on autism says stem cell therapy is not recommended for children and teenagers on autism spectrum disorder. Our latest guidelines by the Clinical Practice Workgroup states it's among alternative therapies which could cause, quote, significant potential harm.
That's right. Now, we are going to dive deeper into the topic with the two people who led the 22-member work group. Dr. Mae Wong is Senior Consultant Paediatrician at KK Women's and Children's Hospital, while Dr. Aishworiya Ramkumar is a consultant at the National University Hospital's Child Development Unit. Welcome, ladies. First to you, Dr. Wong. I'm curious, what's changed such that the work group is now cautioning against stem cell therapy, and what kind of significant potential harm are we looking at?
So I think stem cell therapy, first of all, is actually a recognized therapy for certain blood-borne blood conditions such as leukemias or rare blood diseases. So it's actually offered for therapeutic purposes already in Singapore. However, where it's used for cases of autism, the research has shown that actually it does not improve any autism symptoms at all. There are also different types of stem cells. There are stem cells that lead to increase in replication in other types of blood cells, and there are ones that can actually grow into other types of cells, what we call pluripotent stem cells, and these would then potentially have a risk of cancer and a risk of growing into other tumors that we may not want in parts of the body. So in KK, we actually ran a small pilot trial looking at the safest type of stem cells, which is a baby's cord blood cells harvested from birth. And we actually gave it to children on the autism spectrum because we knew that there were parents who were keen to try stem cell therapy. And we knew that this was unlikely to cause harm. And so far, the study has shown that it actually does not improve symptoms of autism significantly.
Okay, I understand. Now, the list of therapies to avoid include, I'm just going to read here, procedures involving high-pressure oxygen as well as chemicals to remove heavy metals. What are the safeguards here in Singapore to prevent these methods that we've just mentioned from being carried out with respect to treating autism? So
similar to stem cells, these treatments are actually offered for proper medical indications. So for example, high-pressure oxygen therapy is actually used to treat sickness, sort of diving sickness, as well as poor wound healing in diabetes. And it's chelation therapy, used to bind heavy metals, is also used for the treatment of mercury or lead poisoning, should that really happen. But again, there's been no evidence to show that children on the autism spectrum actually benefit in terms of their symptoms of autism when these are used. So we have to be careful that whatever's offered is actually is not causing harm to the child in the first place.
See, I hear this now, and it makes perfect sense to me. But I'm not a parent with a child who I have to look at every day who is ill. And parents or caregivers with children on the autism spectrum disorder, the very fact that they're looking at alternative therapy means that the standard one they feel has already failed them. So they are already more likely, I suppose more credulous, more likely to believe the should not be believed. What sort of advice is out there, Dr. Aishworiya, to prevent this happening?
You said it perfectly, right? Parents and caregivers, they turn to alternative therapies out of good intentions because we all want to see our children improve. But the fact is that there have been a lot of alternative therapies that have come up in the last few decades, and many of them can potentially cause harm to the child. So I think one of the important safeguards is the fact that we have robust clinical practice guidelines. And this was why in our guidelines we intentionally reviewed more than 20 alternative therapies, looking very carefully at the research evidence behind these, specifically looking out for benefits in terms of the features of autism, but also equally importantly looking out for harm as well, potential for harm. So I think a lot of the advocacy and the public awareness would hopefully stem from these guidelines, because we know that use of alternative therapies among children with autism is high. Various studies have quoted anything from 30% to 70% of children having had alternative therapies before. And some of these alternative therapies can be very commonly used, for example, antibiotics and antifungal treatments, which when you look at it from an autism perspective, don't have benefits. And instead, use of antibiotics or antifungals without due indications can actually cause harm to the child as well. So I think it's very important that we raise awareness of this issue. And this is also why in these guidelines, we've actually come up with a lay version as well, meant for caregivers. So caregivers can essentially look at these lay version of the guidelines, as a source of credible information, to try to help them look at all the evidence that's gone beyond these research. And hopefully this will help towards advocacy as well.
I think that's very important, to make the information available, because the volume of information out there for parents, especially, when it comes to things like vitamin supplements, which sound very healthy. Obviously, it's a vitamin supplement. We understand these are quite widely used by parents as a form of autism therapy. What does the science say, though, about the efficacy?
So vitamin supplements are very often used for parents, especially when they're concerned that their children are picky eaters, which often happens in autism. And the science actually says that using vitamin supplements doesn't make a difference, again, to the autism symptoms, although in children who are picky eaters, of course, careful normal supplementation with children's vitamins is safe. However, there are practitioners who actually prescribe very high doses of certain supplements in particular, such that children have presented to us with toxic levels of certain vitamins in our blood, in their blood. What parents need to know is that although vitamins and supplements are safe to a certain level, if they are used at very high levels and they build up in the body, they can cause side effects to the brain, to the liver, and vitamins themselves are not entirely safe in overdose.
Our final question to you, Dr. Aishworiya. The latest guidelines, they effectively replaced the first edition, and these were published more than a decade ago. Jill was talking about the amount of information. Now that 10 years ago, we have a lot more now, many from dubious sources, and you wouldn't even know how and why they are dubious. So your guidelines would have to change, not just with medical progress, but all the other progress we made, or not necessarily progress, the changes in society, in mindsets, in what we value, how we find information. Tell us more salient changes that have been made in these latest guidelines.
Yeah, as you exactly said, our understanding of autism as a condition has grown exponentially in the last decade. And I think one of the key changes is the fact that in these revised set of guidelines, we've expanded the scope to include children as well as adolescents, when the 2010 guidelines focused on preschool children, which was in tandem with this autism scene at that time. And secondly, we also adopted a lifespan approach to autism, and hence we have had new sections in these guidelines specifically on co-occurring conditions, as well as education and transition, follow-up and prognosis, and professional training when it comes to autism. And one of the key messages really is the need for continued follow-up of the child or adolescent on the autism spectrum to look out for co-occurring conditions which are more commonly linked to autism.
Well, thanks both of you for coming and joining us this evening. We've been speaking to Dr. Mae Wong from KKH and Dr. Aishworiya Ramkumar from NUH. Thanks so much for coming.
Thank you.